Well, we're dealing with a very complex crisis, and perhaps it's historical. It's perhaps the most serious crisis in modern history. We have to understand the origins of this crisis, the history, and we have to also define what this COVID-19 really is. Now, it started in China. I won't cover all the history, but essentially the Chinese authorities identified the virus in early January. And then subsequently, then it was, there was a response on the part of the Chinese authorities. And then at the end of January, the World Health Organization declared a global emergency. It wasn't a pandemic, it was a global health emergency. And that was on January 30th. Now, it was taken in a rather contradictory fashion, because at the time when this decision was launched by the Director General of the WHO, there were only 150 cases outside China. And the emergency declared by WHO was pertaining to outside China. There were 150 cases, 6 in the United States, 3 in the UK, 2 in Canada. But nonetheless, that was the dynamics of this initial decision by the World Health Organization. I should mention that prior to January 30th, there was a decision on the part of the World Economic Forum in Davos. It was circa 21 to 25 January, where major interests got together, including the World Economic Forum, the Gates Foundation, various other entities, as well as the head of the WHO. And it would appear that the decision to launch this global emergency was taken at Davos, because in an earlier decision of the WHO, there were divisions within the organization as to whether it should be launched or not. Now, what is significant is that on the 31st, the day after the launching of this campaign by the WHO, there is an interruption in trade and air travel with China, which immediately has a backlash not only on the Chinese economy, but on the flow of international trade. And at the beginning, the numbers were very reasonably low. In effect, 150 cases for a population, a world population minus China, which runs about 6.4 billion people. That situation then evolved, and the levels of virus infection increased. I should say the estimates, because we're not entirely clear as to whether those figures on confirmed cases or mortality actually correspond to the real life situation. And that has to do with the fact, and I verified this in detail, that particularly in the United States, they have presumed cases, they have confirmed cases, but one or the other does not prove that there is infection caused by the coronavirus. Now, there's another thing which has been withheld from the public, and I must say that the media has initiated a fear and panic campaign, which is very detrimental. Rather than reassuring us, this particular virus, the symptoms are identical to those of seasonal influenza and pneumonia. And from a medical standpoint, the nature of the infection is very, very similar. So that makes it very difficult to actually come up with estimates, because in some cases you might be estimating influenza, and there's no way necessarily to be able to isolate the virus. I don't want to get into the technical details, but I can say that in the United States of America, those figures absolutely are not reliable. To put it bluntly, when you take a presumed case, which is essentially from a private clinic where you go and see a doctor and then he says, oh, you've got the symptoms, etc., then he might take a specimen and send it to a lab. But that's a presumed case. And then you have the confirmed cases, and those confirmed cases do not necessarily even, are not necessarily based on an actual positive lab test. You add oranges and apples together and you get a total number of cases. There's nothing in those statistics that is reliable. So that the statistics in the United States at the moment are heavily biased, and there is also a tendency, and this comes from the testimony of doctors and so on, that they're trying to push the death rates up, so to speak, and the confirmed cases, there aren't any confirmed cases because they're lumped together with the presumed, but they're trying to ultimately make those figures increase, and that is tied in with the fear campaign which is launched by the media. Now, what is very disturbing is that some of the protagonists and main actors in the United States, I'm talking about the Center for Disease Control on the one hand and various other entities, they are very specific when they publish in peer-reviewed journals in identifying the features of the coronavirus. They will say it very explicitly. And the WHO will say it very explicitly. And they will say mild symptoms, in most cases recovering in 2 weeks. Now, nobody is telling us that. Nobody is telling us that this is not a dangerous infection. There are complications, but for 80%, according to WHO, the recovery is routine, and that it is very similar to a seasonal influenza or pneumonia. But what happens is that the specialists, which are senior government officials, they write in their peer-reviewed journal, New England Journal of Medicine, they rate one thing and they say it's similar to influenza, and then they go on CNN and they say it's 10 times worse than influenza. That is, to put it mildly, that's a lie. And it's a contradiction of all the scientific statements that they make. So that I think that we have to understand, the broader public has to be informed as to the nature of this virus. It is seasonal influenza or pneumonia. It has to be reassured that we're not dealing with something which is really dangerous if it's addressed medically, and thirdly, there's a process of recovery. Now, the other aspect which I think has to be addressed is the fact that with the measures taken throughout the world, including lockdown, in other words, people staying at home, the impacts, the social and economic impacts of those lockdowns are absolutely devastating. Why? Because they close down the economy. They close down national economies. They lead to mass unemployment. And in some cases, in developing countries, they're leading to famine. All of this is documented. In other words, the impacts of a lockdown which is poorly implemented with insufficient medical staff. The situation in the United States is very serious, but is also serious in a large number of countries. And in developing countries, it is absolutely beyond description, because 40 or 50% of the urban population they receive their pay on a daily basis. They might be self-employed, they have small businesses, And what these measures are doing is liquidating, literally liquidating small and medium-sized capital to the benefit of big business and big corporations. And so that is something that we necessarily have to address. It's a very complex crisis. Don't believe what your governments are telling you. Consult the views of the medical profession, who are speaking out honestly and telling people what's happening, and analyze the statements of officials and see whether they're consistent. This is not a dangerous infection, but if it's addressed by the relevant health authorities, but what is absolutely dangerous, and it's not spontaneous in any regards, is the collapse of the real economy, the financial crisis which accompanies this so-called pandemic, and that's not spontaneous either. There's evidence that the stock markets are manipulated, and all this is leading into an impoverishment at the global level in both the Western countries as well as in the developing countries.
The Center for Research on Globalization depends on your support. To make a donation or purchase a book or DVD, please visit globalresearch.ca and click Donate on the menu bar.